My first impression of Peoria was that it was a small town and that there wasn't that much to do. But once I got here, everyone was so warm, so friendly.
Driving through Peoria for my interview, I was really amazed and impressed.
It's a smaller city, but I think that sometimes it actually feels bigger than it really is.
Peoria to me is just a great place to live. It's really easy to get around. You don't have to fight traffic after a long day of being on call, and it's really affordable.
There are a lot of things I really love about Peoria.
As a family, we love to go out and go to orchards. We love to come to the Riverfront Museum. We love to go to the Children's Museum here. We love to go biking.
So I love how easy it is to get around. I love the convenience of the community. There's affordable housing.
I can truly say it's the best of both worlds. You have a lot of the big city amenities without the traffic, which is awesome.
We wanted an international airport and a Costco, and it had both of those.
The idea of being able to run to the airport, park for free, and be able to fly anywhere I want to fly, I really love that about this community.
Hi, my name is Dr. John Gelbach. I'm a pediatric intensivist at the Children's Hospital of Illinois, at the OSF Healthcare System, St. Francis Medical Center, and I am the program director for the brand new Pediatric Critical Care Fellowship Program here at the University of Illinois College of Medicine in Peoria. We're extremely excited to be starting this brand new fellowship program and feel we have a lot to offer to our prospective trainees in terms of a fantastic clinical working environment in our pediatric ICU, as well as a very collegial work environment with the rest of the staff in the unit. We are also feel we have a ton to offer in terms of academic productivity options for fellows in terms of research, quality improvement projects, simulation research, really a far range of opportunities for whatever fellows might be interested in.
So my name is Ed Martinez. I'm an assistant professor with the Department of Pediatrics, and I work in the pediatric ICU, one of the attendings here. I was a a trainee here, a resident and a student, and I knew that our PICU was a great place for training because we get to see a lot of diversity and pathology and different types of patients you're taking care of. I went off to fellowship and I trained in a similar environment, and I always knew that Peoria and the Children's Hospital of Illinois had a PICU that would be able to provide the same training that I got. So being able to come back here as an attending, I think I'm really excited to be able to be part of this program that's starting up, because I think we're going to have a really good program where we can offer a lot and train really good intensivists here.
We function in a mid-sized, mixed unit intensive care unit. We care for both a medical surgical population as well as a cardiac ICU population, and have a fairly busy cardiac surgery program with 2 cardiac surgeons. We also run between 15 to 20 ECMO pumps a year and see close to 1,000 admissions on an annual basis. In the pediatric ICU, we care for patients that have a variety of suffer from a variety of different illnesses, things such as run-of-the-mill bronchiolitis to more unusual diseases, autoimmune conditions, certain surgical problems. We have ear, nose, and throat physicians that have recently started doing airway reconstruction procedures. We offer continuous dialysis, as well as some novel modes of mechanical ventilation, such as negative pressure ventilation, NAVA, which is neurally adjusted ventilatory assist mode on mechanical ventilation. So we're excited for the many things we have to offer trainees that are interested in pursuing their critical care training here in Peoria.
So the pathology here was one of my favorite things as a resident, because you get to see and do a lot. And I think one of the reasons is being in Central Illinois, we're the only major children's hospital for miles, and we capture most of Central Illinois, and we get right around Springfield up until Joliet, and as far as Iowa and Indiana. being able to take care of all of those type of patients at the same time in one day, I think really is a valuable point, a piece for your education, and as not was for me as a resident, but I think even more so as a fellow. Again, I trained down in St. Louis, and I had a very similar unit there where we had the same type of population, and it was kind of a mixed unit, and I just can't express how valuable it was as a fellow, as a learner, to be in that type of environment.
The Children's Hospital of Illinois is a hospital within a hospital at St. Francis Medical Center here in Peoria. The St. Francis Medical Center is part of the OSF healthcare network that stretches throughout the northern part of the Midwest. The Children's Hospital is mainly housed in a newer part of campus that was opened in 2010. The Pediatric ICU is a 16-bed unit that's housed on the 4th floor of the tower, which is the pediatric critical care floor. That includes not only Peds ICU, but the Pediatric Intermediate Care Unit, which is another 16-bed unit. One of the wonderful things about the space we work in is that either one of those 16-bed units, the Peds ICU and the Intermediate Care Unit, have the flexibility to accommodate whatever needs are there for the patient. So at times we've had up to even 20 ICU patients on the floor, so all those Intermediate Care Unit beds can flex up to be ICU beds. So it provides us a tremendous amount of flexibility to care for whatever the children need.
The SIM Center, which is the Jump Simulation Center, I mean, it's state of the art. I've been on multiple resident interviews, fellow interviews at really big name hospitals across the country, and no one can touch our SIM Center and the facility here. It's again, it's state of the art, and to be able to do now as an attending, we do a lot of simulations and trainings there. I really felt as a resident it helped us prepare for when we saw it in patients live. And so as fellows, being able to utilize those same resources as part of your training, I think it's going to be invaluable to have. And I think you're really going to enjoy getting into the Sim Center and using their resources.
In addition to the clinical research and simulation research opportunities available for our fellows, we also have a strong track record of quality improvement projects and patient safety projects. And we're excited to have that opportunity to partner with residents in our pediatric residency and medicine pediatrics residency programs. Although we're a relatively small hospital compared to some of the large academic centers, I've really been impressed since I've been here with the research projects and QI projects our residents are able to churn out year after year. Likewise, our medicine pediatrics combined residency program is one of the oldest med-peds programs in the country, and I think the residents we're able to recruit here and graduate from our program really speak to the high quality of those respective residency programs. The fellows that we are hoping to attract to come join our program are those that are really interested in becoming academic pediatric intensivists. We have a very collegial working group. We have 9 intensivists along with 7 advanced practice providers, and work very closely with the nursing staff in both the pediatric ICU and the Peds Intermediate Care Unit. And we're looking for fellows that can function very well within that team-first environment. We know that the staff, both our advanced practice providers and the nurses and the respiratory care providers, all have a world of experience that can only serve to make our job easier and provide better care for the children that we are in charge of. And so we're looking for fellows that will fit nicely in that mold.
We have a really good team with good camaraderie amongst the intensivists and the nurse practitioners here, and the nursing staff and the managers here. Our division head, Dr. Nabil Hassan, has done a fantastic job of putting together a team that just gets along well, but is here for patients first. And we're here for each other, but everyone has the same mentality. It's about the patients first. So I think the environment here, as far as the intensivists go, we're laid back, we're a good group, we have each other's back, and we have everyone wanted to be in academics, so everyone has this teaching first mentality. We love having residents, and we're excited now to be able to teach fellows as well.
Pediatric ICU, it can obviously be a very stressful environment, not only for patients and families, but for staff as well. We're always willing to look out for one another, and particularly in terms of the faculty that I work with, you know, if any one of us has something come up in our family lives, that it's very easy to find coverage. And I think that is true throughout both the rest of the pediatric faculty and the residency program itself, that is the parent program for our fellowship. I'm thrilled to be back in Peoria and hope to spend the rest of my career here. It really is a lovely city to settle down, and was talking to some colleagues about this the other day. And well, if you haven't been through Peoria or around this part of the state, it's a city you may not have heard of before, but I think for a lot of people that end up here, it becomes somewhat of a hidden gem. And we see a lot of people that move to Peoria for whatever reason and end up settling down and never want to leave, because we're just a great little city here.
So my wife's from California, and so we fly to California frequently. We try to go every 2 months for a long weekend, and so part of that is because we're able to fly out of Peoria International Airport, that it makes it a lot easier to traveling with kids. I can leave the house 30 minutes before my flight and be at the gate with 15, 20 minutes to spare. It's usually, I mean, if we have to check bags, maybe we leave a little earlier, but parking is free. You get to your gate and security within minutes. It's fantastic for those who travel with families, especially, but anyone traveling. With my family being in Chicago, we drive up to Chicago often as well, at least once a weekend a month, and that's a 2.5-hour drive up to Chicago. And we got to know St. Louis, so we'll go down to St. Louis 2.5 hours. So we'll take the weekend. Whether it's going to the Cubs game up in Chicago, or we'll just stay at a hotel or at my parents' house and enjoy that. So we do travel out frequently, at least once or twice a month, to see family. And it's very easy to get in and out of town. So,
one of the things that really drew me back to Peoria is how easy of a city it is to live in. The traffic is very minimal. The cost of living is fantastic. Really anywhere in town you can get to in 10 or 15 minutes. And it has several big city amenities, but very much of a small town feel. And I think that's true of the hospital as well. Thank you so much for your interest in our brand new Pediatric Critical Care Fellowship program. If you have any questions about our program or about the city of Peoria, please do not hesitate to reach out to either me as the program director or any of the other contacts you see on the fellowship program website. We hope to get a chance to meet each and every one of you, and best of luck in the rest of your training. Thank you.
Hi, my name is Julia Samanda, and I'm from Wausau, Wisconsin.
From Markham, Ontario, Canada.
From Joliet, Illinois.
From Rockland, California.
From Kansas City, Missouri.
From British Columbia, Canada.
From Rushville, Indiana.
And I'm from Chico, California.
So I knew that there was something special about this program immediately.
I loved my time in Peoria as a resident and as a medical student.
Some of the things I like about our department is how supportive our faculty are.
It's a really tight-knit community.
There's lots of benefits to having a 24-hour open cafeteria. It's also nice having a little group of 10 people to call your family as you progress through these 3 years. Everybody has each other's backs, and that goes a long way when things look a little bit difficult.
I can honestly say it was an incredible training experience there.
I really wanted something that was family friendly and well-rounded.
You have an incredibly supportive learning environment, and the volume of patients that you see is incredible.
Here's one of the benefits of coming to Peoria is you get to put in some work with Life Flight.
I really encourage you to look into this program because there are so many wonderful benefits, and you'll have a really great experience if you train here.
Hope to see you in Peoria.